I'm here working on setup for the ReadyStick modular ECMO system. I'm going to be working primarily on the clear neck and the clear rigid heart today, but the operation is very similar if I'm working with any pigmented parts or the ultrasoundable chest. So I can go ahead by aligning my jugular vein, and pull through a little bit extra of this, and my carotid artery with these barbs on the heart. And that kind of works by just pinching one side and pulling it over the barb, and then working on sliding it up. You can apply some isopropyl or water to the barb of the heart if it helps. But I'm just going to make sure that that vessel gets all the way up and over until it gets the neck of the barb. I'm going to do the same thing with my larger jugular vein. Once again, just working my way up the barb. Until it's fully seated on there. Now I can go ahead and lock my two bases together. That's going to happen with these little rotational locks. So I can align the cog shape, outline, and the base. The bases that have fixed positions are numbered as well, but I can go ahead and place my lock in there and rotate it clockwise until it tightens up. You can get these things pretty stiff, and then the two bases are going to be solidly connected. Now I'm going to pinch my jugular vein at the heart barb and pull it tight, and do the same thing with the carotid artery. I'm just pinching them to make sure I don't accidentally pull them off the heart barb and undo all of my hard work there. Now I've got two manifolds. I've got a couple of barbs and a Y with some tubing. I'm going to take my barbed manifold with all pieces attached and slide it into the proximal end of the model. Just like with the heart barb, the carotid artery and jugular vein will both attach to the top. And I'm going to take my Y-shaped manifold and plug it in to these quick disconnects at the bottom. You really want to make sure that these are fully seated in the model. So just applying a good amount of force to get them locked all the way in there. And now this model is all set up and ready to be primed and operated on. Now that the model is set up and ready to be primed and operated, I can go ahead and work with a 1,000 milliliter filled IV bag, as well as the collapsible IV tower. It's important to note, this thing you just pull out to the front side, slide it up, lock it in place. It'll stay there with your IV bag on it, and that way you can adjust the back pressure that you're seeing. It's also important to note that this has a concave and a convex side, so pay attention to where you decide to put on the base, as it will have spots it likes to lock into best. I can go ahead and lock my IV tower into the base. I'm going to raise it to max height for priming. It's obviously easiest to prime with it all the way up. Slide my IV tower on there and go ahead and connect it to my distal manifold. I'm also going to double check to make sure my proximal manifold has one valve open. This will allow me to get air out through the system as I start to prime. And I can go ahead and open up my IV bag. And I should start to see flow through the model. So take a little bit of time. I can raise the IV bag for additional head pressure if I'm trying to get it to prime faster. Though there's a good amount of volume in the heart. I'm going to prop my proximal manifold up. That way when I see flow come out of there, I'm quick and ready to close it off and it won't continue to leak. And I can tilt the model as I see fit to release any other potential air bubbles. Once again, just slowly watching those bubbles work their way up until they're now in the carotid vein, or carotid artery, jugular vein. And I'm now getting a small dribble out of the manifold, so I can go ahead and close off the external port there. And if you've trapped any other bubbles in the heart itself, as I know this ventricle and atrium have a tendency to get some air stuck in there, you have an additional port placed on top of the heart to allow you to open that up to air and close it off to stop any bleeding happening there. I'm going to lower my bag a little bit just because I don't need that much back pressure for what I'm about to do. And we can now move into operation on the model. Now that the model is full of fluid, ready for operation, I can go ahead. I'm using water to wet my probe down instead of ultrasound gel, but that works fine. The models already have a decent amount of glide on the tissue, and I can track my jugular vein and carotid artery all the way down the neck to where they're going to go into the heart. So I can go ahead and line up my initial needle insertion. And I can track, the needle tip right above the jugular vein, all the way down. So I puncture and now in the vein, and I start getting a little bit of flashback based on the height of the bag. So again, I can reduce that if I'm wanting something different. I can now go ahead and introduce my wire into the model. I'm going to lower this just how much bleed back I'm getting out of that. Go ahead and introduce my wire through the needle. I can actually, using the probe, track the tip of the wire all the way through the model as well until I can visually see it in the clear heart. I can position my hook correctly. As you can see, I've actually gone into the ventricle here. So I'm going to take another approach. Twist this around. This is part of the simulation practice. Hopefully you're doing this with a less bent wire than I am. Till this time I've correctly threaded the wire through. I can now go ahead and take my dilator. The tissue will actually accept a cannula right away, up to 23 French. It does not need any dilation. I'm going to remove my needle. It does not need any dilation to properly fit a cannula. If you're using something with a Rougher surface, you may feel a need to use some lubricant. That's what the included soap is for. In this particular case, because I'm just using a dilator, not a cannula, I'm going to go ahead and just go straight for one insertion. But if I was using a catheter and had any kind of tracing on this, I could also locate that under ultrasound. As you can see, I can go ahead and visually inspect the cannula as it makes its way down into the heart, and I position it wherever I want to, or run whatever simulations you want to at that point. It's important that you do not make any incisions to guide the cannula in. Lubricant is far preferred, as an incision will shorten the lifespan of the tissue. And then once you're done, rather than leaving this sitting in here, again, for the lifespan of the tissue, I can go ahead and remove my cannula, or dilator in this case, remove my wire, and we can visually inspect just how much tracking there is under that insertion point, where you can see very small remnants of the needle tracks left over from this dilator. So that's how well you can expect that tissue to heal up. It's not bleeding out of there anymore. You should get at least 20 uses out of the tissue, and we're finding between 5 and 10 out of the vessels, depending on how aggressive your operation is. Once you're done, you can go ahead and drain and flush the model if you were using any sort of chemicals inside of the model, and you'll be ready to set up for your next use.